Hi everyone. In today's lecture, we're going to be talking about assessment. So I did just want to open up with what assessment is. When we're looking at assessment, we are looking at observations, recordings, documentation, all regarding children's learning and development. So we are looking at children in different types of environments that they might be in, such as indoors or outdoors, or even just looking at different times of day that they might be playing or interacting with others. We're taking work samples. We are seeing how they interact with peers and different adults, how materials might influence their types of play, or how different transitions throughout the day might influence how they are feeling emotionally. So all different types of ways that we are going to look at children's learning and development to determine how they're going to need different types of support. So all of these different types of assessment tools that we might use help us to assess children and see what kind of information we can gather to better support children in the classroom. So I've included a nice article here from NAEYC that talks about developmentally appropriate practices and how we might go about observing, documenting, and assessing children's development and learning. Let's talk about some different types of assessments. So developmental screenings can be put in place before children are already in your classroom. So prior to working with children, you can give them assessments to determine different kinds of skills that they have. And this helps you to notice what kinds of supports are needed prior to a child coming into the classroom. Later on, we're going to be talking more about readiness assessments, so helping children to be ready for kindergarten. Other types of assessments that look at supporting learning and development are set in place when children are already in your classroom. So you already are getting to know children and we're checking in on them to see how we can best support them when they're already in our care. So this might be that we're just doing general assessments on everyone to see how we can modify and adapt our environment and our teaching skills and things like that. But it could also be that we're noticing a shift in the child's behavior or their ability to learn and play along with others. And so we give them an overall assessment once they're already in our care. And this is authentic assessment. So again, we're checking in to see what kinds of supports we can set in place based on our caregiving methods, the materials that we set out, and the way our environment is set up. Another way that we might do assessment for learning and development is through standardized tests. And this is not often used with children around this age just because it's not as developmentally appropriate as authentic assessment. So children are filling in bubbles in small spaces, and the results of these kinds of tests are not released in enough time for you to actually be able to modify and switch up your environment and provide supports that children might need. But most of the time when we are collecting different types of assessments on children, we're observing them, we're collecting work samples, we might be going and filling out checklists, we're collecting pictures and recording videos of children, doing things like running record notes. We'll talk a little bit more about DRDPs later. So there's lots of different ways that we can authentically assess children. And your textbook gives some great information on different types of assessments and things that you might need to know on 165 to 174. And the link on this screen also talks about ages and stages, and it discusses the difference between screenings and assessments. So I highly recommend checking that out so you can see the breakdown of these two types of assessments and how they're used. On this slide, I wanted to share a little bit more about the best types of assessments that we should be practicing when working with young children. So I mentioned previously that sometimes we might be using standardized testing, but this is not often the most appropriate way to assess children's learning just because it's not developmentally within where children are at and meeting their learning needs. And NAEYC does not recommend standardized testing until children are 8 and above and recommends that we use authentic assessment. So authentic assessment uses information from parents and teachers, gathering things about how the child is learning and developing and things that the child might be doing in the classroom, how they're playing during daily routines. And it's a way to revisit children and address their skills at different points and in different contexts. So I'm not just sitting there for a 30-minute session and saying, well, this is all the information that I got, and this is the only thing I'm going to use to determine whether or not the child might need supports or if something needs to be changed in the way that we are helping the child. So we're looking at different time frames, we're looking at the environment in a variety of different contexts, and we're seeing that there's not one size fits all for assessment, and the classroom teachers are often not experts in assessment, and so it's really vital that we are considering working and partnering with other professionals such as school psychologists or other trained areas of people who can better support and understand the types of assessment tools that we're using for more accurate results. Another thing to consider is a child's culture and home language. So if we are not assessing a child in their home language, we might not get the same type of results if we are assessing them in their home language. Same with when we're communicating this information to parents. It can be extremely difficult if there's a language barrier or a cultural differentiation in the way that we are helping the parent to understand the types of supports we might set in place, and we might be missing out on opportunities to get the best type of assessment if we're not considering culture and language. It's also important to look at a child from all different points of developmental domains. So we've discussed all different areas of development, and we shouldn't just be looking at social and emotional development, or we shouldn't just be looking at cognitive development. We should be looking at each piece of development to help make up the whole entire child. And so again, your text talks about different types of ways that we can best support children in understanding best practices on 174 to 175 of that before, during, and after process, and also recognizing that we need to keep information private and confidential. I forgot to mention that's the first point on here. So that's really important too. Anytime that we're doing assessments or we're looking at children's development, we want to make sure that we are keeping that information confidential. Oops, sorry, the audio got cut off here. Basically, the graphic on the next slide just looks at the different types of skills that children might need to be ready. So the different building blocks of readiness. So it looks at physical, social, emotional approaches towards learning, communication and language use, cognition, all different types of areas that children are going to need to be equipped and readily able to be in a kindergarten classroom. So on the graphic, it talks about being able to grip a pencil for motor skills, being able to have self-regulation, so following rules and playing with others cooperatively, social expression where they're eager to learn, all different types of skills, and it's not just in one area. So we're seeing physical well-being, we're seeing communication, we're seeing social and emotional health, all different areas that are important for children to be ready and able to participate in a kindergarten classroom. And really what we want to see is that we're making sure that children are ready for kindergarten and identifying areas that children might need supports set in place if they are not meeting these different types of standards for skills and readiness, and seeing what we can do to help set them up and get them ready. Let's talk a little bit more about kindergarten readiness. So basically, we're just looking to see, do children have a certain set of skills that they're going to be ready for kindergarten with? And not everyone agrees on the same types of skills that are needed for kindergarten, and tools that might be used to assess children could look different depending on the area that you live in, as well as the type of understanding of child development that someone has. And I included a little video here where a teacher talks about different types of tips from her perspective on what a child might need to be ready for kindergarten. So I recommend checking this out. And we also see that 60% of children are often not ready for kindergarten. And on the next slide, you'll see that the National Education Goals panel, I provided an image there, and really it when we're looking for children to be ready for kindergarten, we're looking at a few different things. And the first one that we're going to talk about is the pre-K standards. So these are things that we are helping children to work on to be ready to go. So we've talked a lot about the California Learning Foundations and all different areas of development in this class. And in the state of California, using the Learning Foundations are ways to look at how children are going to be ready for kindergarten. So these are guidelines that align with a child's age and help us to better prepare children for the next steps in school. And there's information more in your textbook about the standards, so I recommend checking that out from 153 to 163. So knowing what the different pre-K standards are, and these should align with developmentally appropriate practices, as well as the learning foundations that we talked about. And basically, we're just seeing how we can better support children in the different types of skills and areas that they are engaging in during their day-to-day, and thinking about how we can support through child-directed and play-based activities, as well as creating curriculums that are going to benefit children in all areas of development. So again, we're thinking about these areas with a well-rounded scope. So I'm not just looking at cognitive development, and I'm not just looking at language development, but I'm looking at how those two areas are going to be used with one another. So if a child is working on a puzzle, and even though they might not be saying things out loud, such as how they're matching, I can see that the child is able to correctly place the puzzle in different areas of where they go. They're also using their fine motor skills to pick up the different puzzle pieces and put them in their places. So I'm looking at a variety of different skills in different types of contexts. Same with if a child is eating, they're using their fingers or their hands to pick up the food, as well as potentially using chopsticks or different types of silverware, and they might be communicating with their teacher that they're all done or they need more. So being able to use language and a connection with the teacher for social and emotional health, as well as self-regulating when they're ready to be done or if they still need more food, being able to wait. So many different skills that children are working on. And basically the rest of this slide just talks about the child development division and what that looks like for preschool learning foundations, as well as how we also have infant and toddler learning foundations. So from birth to 36 months, and then the preschool foundations is 36 to 60 months. So those are the ones that we are primarily using in this course. And another thing that we want to consider is how readiness is not going to take away from appropriateness in early childhood education. So we want to make sure that we are helping to prepare children using knowledge of these pre-K standards, but we are not taking away opportunities for healthy early childhood learning based on what we know about where children are at, meeting their needs, using developmentally appropriate practices, considering again that child-directed and play-based approach. On this slide, we're going to be wrapping back around, and on the next slide, to the readiness assessment, as I was talking about at the beginning of today's lecture. So really what readiness assessment is looking at is a way to determine, using different types of screening schools, if children are ready for kindergarten. And there's different types of assessments, such as the KRA and the KEA, so the Kindergarten Readiness Assessment and the Kindergarten Entry Assessment. And these are different types of assessments that are used to see if children are able to come into kindergarten right away, if children need to wait to come to kindergarten, or if we need to put support set in place to help them to get where they need to be. And you may have heard of the tool called DRDPK, which is aligned with the preschool learning foundations that we're using in this class. So basically, this is the desired results developmental profile and is used in classrooms, preschool classrooms that are state funded. So specifically at our campus, Cal State, we use DRDP. So if you are familiar with being in a classroom, you may have heard of this before, and basically it's just a way to take assessments, so taking notes, pictures, looking at children's development to determine how well they are measuring up with the foundations. So if children are able to regulate their emotions on their own, what kinds of tools and strategies are they using? Are children able to engage in self-feeding? Are they able to recognize when they're having a big emotion? Are they able to communicate their needs and wants with their peers and teachers? Are they able to get dressed and undressed on their own? Are they able to look at different types of materials in the classroom and appropriately categorize them? All different types of things that we might be seeing for different areas of development, and using those as a way to determine what children know and what children do not know. And then once we are able to see this, we're better able to put different types of systems and supports in place for children. So I've included the link here for that. So I recommend checking out the DRDP tool so that you have an understanding of how that connects with the preschool learning foundations. A little bit more about the readiness assessment. Basically, we want to see this as a tool being used to support children and not a way to prevent them from being able to go to kindergarten. So oftentimes we see that this puts pressure on children, parents, and programs if children are not accepted and placed in a program. So in California, the assessment tool for readiness is not given to children right before kindergarten, but it's actually given to them while they are already in school, and this helps to put those necessary supports in place. So we're not giving the assessment tool beforehand and saying, well, if you aren't where you should be at, then you can't join. We're saying, okay, here's where you're at, and here's how we can better support you, and what kinds of interventions can we put in place, how might we adapt our teaching, looking at different types of interventions and instructions, and using these results as a way to better prepare teachers, plan appropriate activities, and meet children's learning needs through the type of activities that we're doing and the types of interactions that we're having with children. So again, we're looking at that broad scope. All areas of development are looked at to better support a child and seeing how we can support their overall success and well-being while they're in school. Last but not least, we see that one more way that we can help children and look at kindergarten readiness is through change of age in the entry. So cutoff age groups. So in 2010, the Kindergarten Readiness Act was installed, and basically it just indicated that we were going to switch up the age of entry for children. So children turning 5 by September, which is right around the time that school is going to be starting, this is when the cutoff age date would be. And then transitional kindergarten, which is fairly new, is a way to help children who are not turning 5 before that cutoff date. And so children with birthdays past that cutoff date, September through December, who are turning 5 in that time frame, are then able to get enrolled in transitional kindergarten. And so the video on this slide, at the top of the slide, helps to better explain what transitional kindergarten is, and then it helps to see where children might be at. So again, it's just basically looking at, there's a cutoff date for age based on what we know about children's development. So all of those different learning foundations that we've talked about, the DRDP types of tools that are used in California preschool classrooms, help us to better see that before age 5, most likely children are not going to be as prepared to enter kindergarten, and so we're going to make sure that we give them time within their age to get to those types of skills. And even if they are turning 5 after that cutoff date, we still have an opportunity for them to be in a position at a transitional kindergarten that gives them opportunities to work on different types of skills. Now, unfortunately, there is a term called redshirting, which is used to make children wait until they are ready, even though they have met the age requirements. So basically, they're not able to come to school, and the reason it's called redshirting is it's an old, outdated, sports kind of term of being put on the bench, and it's used for kindergarteners who are waiting to come into the playing field of the kindergarten classroom. And unfortunately, it does not seem to benefit children in the long term, and early childhood educators and professionals in the field do not recommend this as a way to support children for kindergarten readiness. So other alternatives for this, again, are transitional kindergartens, or even working at home with families to get children ready and prepared. So having knowledge of the different types of readiness assessments and standardized pre-K standards that are going to be used for getting children ready can better support them than just having to be that term redshirted, as I mentioned. And last but not least, just wanted to share one more slide related to transitional kindergarten. Couldn't fit everything on the previous slide, so this has a link for you to look at, and it also, this slide has a graphic that just shows the importance of what transitional kindergarten can do in improving school readiness. So if your child does not meet the age requirement, that cutoff date, how putting them in transitional kindergarten can support them And the data is still coming in about this because transitional kindergarten is a fairly new way of schooling for children. But if you take a look at the link, it will show kind of the pros and cons of this type of system, and really just recognizing that proper credentials and background knowledge on early childhood education is an important way to create transitional kindergarten classrooms that are going to be most effective. So it should not be a mini kindergarten, but it really is a transitional period between preschool and kindergarten. So it's a way to support children who are not quite ready for kindergarten based on their age, but are aging out of preschool. And so it's kind of a stepping stone for them. And we're keeping children in this position of a transitional kindergarten to help to prepare them for that school readiness in kindergarten. So we're still using child-directed and play-based learning opportunities. We are considering how curriculum is going to be developmentally appropriate, and we're using developmental screenings to answer the question of what can we do to make the classroom environments and our teaching strategies better for children.